Welcome back, guys. I hope you are all doing well. So, today's my topic of discussion is about the fifth lobe of the brain, which is present deep in the brain. Okay, we have to remove the temporal lobe and we have to see the deep in the temporal lobe. There is one more cortex, which is insular cortex. Insula. Okay, so the insula is the mini lobe of the brain, which is the fifth lobe of the brain. First, frontal, parietal, temporal, occipital is the fourth lobe of the brain, and most of the books write these four lobes. And there is a fifth lobe also, which is the mini lobe, which is called insular lobe. Okay, so guys, first I draw the structure and show where it located in the brain. I draw the coronal section of the brain. Okay, how you remember that this is the coronal section of the brain? Because there is a suture which is present in the bones of the skull, which is coronal suture, which joins the frontal and the parietal lobe. The direction of the suture is this direction. Okay, so I have to cut the brain in this direction, and I have to show you at the level of parietal lobe. Okay, so here is parietal lobe, here is temporal lobe. If we remove the temporal lobe and we have to see deep in the temporal lobe, here is one more cortex, which is called insular cortex. Insular, insular cortex. Okay, now I gonna explain to you what are the functions related to it. Okay, insular cortex, and what are the pathway involved in insular cortex. So first I draw some more structures. This is your viscera, this is your heart. Okay, imaginary heart, not a real heart. I just imagine the diagram. Okay, this is your lungs. Okay, through which you can breathe. This is your GIT. Okay, intestines and GIT, stomach, intestine and GIT. These are all your visceras. Okay, viscera. What are the viscera? Viscera are the structure which viscera is the layer. You have to remember the viscera from the layer. There is parietal and visceral layer which covers the organs. So which of the layer from the parietal and visceral layer covers very tightly with the organ is visceral layer. So all the organs are visceras. Okay, so these are all the visceras. Second one, this is your cochlea of the ear. Okay, your ear, internal ear. Okay, and this is the second one. Okay, and now I have to draw your tongue. Okay, and I have to separate it. Anterior 2/3 of the tongue and posterior 1/3 of the tongue. Okay, this is anterior 2/3 of the tongue, this is posterior 1/3 of the tongue. Okay, so what are the function of insular cortex? Insular cortex receive the information from three regions of your body. Okay, your viscera, your organs, from your lungs. I have to draw in blue color. From your lungs. Okay, from your heart, from your GIT. Okay, all the visceral information related to pain is goes to this insular area. Okay, this is the first function. All the visceral sensation of the pain goes to the insular cortex through the pathway. Okay, so this is the first function of insular. How it controls the pain? Okay, when there is any pain which occurs due to respiratory due to heart angina pain, or due to git gastritis. When there is inflammation in the stomach, gastritis, the pain is origin of the pain occur. So the pain travel to this area, okay, towards the insular cortex, okay, towards the insular cortex. And what insula do, the information which goes to the insula uh, add information in his own memory, okay, insular memory, okay. And when there is, you can see this food is causing a pain in my stomach, okay. So at the first time you eat and you feel pain, okay. Now the second time when you see the same food and you remember, okay, this food I cannot eat again because it caused pain when I eat previously, okay. So you cannot eat. So this type of the memory and emotions and related control related to the pain is controlled by insular cortex, okay, insular cortex. It's in the same manner when there is a heart which become in painful, okay. When you are doing any exercise and you feel pain, okay, you feel pain and you have to stop the exercise. Next time when you do again exercise, okay, and you feel that you remember that, okay, I do in previous time I do this exercise and I feel pain, so I cannot do this type of exercise. So this is the memory, okay, and this memory is controlled by insula, okay. Now let's talk about the other function. First function is control the visceral sensation of the pain, okay. So next sensation is from the internal ear, okay, which goes upward towards the insula, okay, internal ear. And the third function is your from your tongue. There are different type of taste, for example sweet taste, sour taste, bad taste, good taste, okay, of your tongue. And you have to feel it, okay, and because of your taste buds which is present on your tongue, okay. Different nerves travel towards the brain and enters in the insula, okay. All these three functions of the insular cortex is controlled under the control of insula, okay. First function, again repeat, first function, sensation of the pain of the viscera, okay. And remember the memory of the viscera pain, and the patient cannot do same type of activity again. This is the first function. Second function is internal ear of your ears, okay, internal ear, okay. Ear three part: external ear, middle ear, internal ear. So internal ear sensation goes to the, where it goes to the insular cortex, okay. And it also goes with the towards the cerebellum. Here is your cerebellum, okay, for the equilibrium. The information also goes towards the cerebellum for equilibrium. So insular cortex also a role in equilibrium, okay. First function is visceral sensation, okay. Second function is equilibrium, and last function of the insular cortex is control the different taste and recognize the different taste, and is the taste is previous taste or not, like this type of comparison between the taste, okay. All the information goes to this pathway and go to the insular cortex from your tongue, okay. Many type of sensation, like there is a sour sensation, there is a bitter sensation, there is a good sensation like sweet sensation, okay. And one more sensation which is umami taste like sensation, okay. This is also a special type of sensation. So all this sensation goes to this area. So if there is damage to this area, okay, any pathway related to under the control of your insular cortex, when there is damage to this area insular cortex, so this is the clinical importance, guys. This is very very important. Clinical, what is the clinical? When there is damage to this area insular cortex or any pathway related these structures, okay, you cannot feel the pain of your heart, you cannot feel the pain of your git, you cannot feel the pain of your respiratory system, and respiratum goes to fail and you have to die, okay. When there is a severe pain and you cannot feel it, so you can die without feeling any pain, Okay, most of the cases in the emergency or in the not in the emergency patients are those patients which feels pain and go to the emergency because he or she feels pain, that's why he goes to emergency. So most of the patient you see in the environment goes without any pain, he is sitting or she is sitting and go to die, okay, with no feel of pain. So there is a damage to this area, there is a not functional of this area, that's why. Okay, so there is a not equilibrium, the patient whose this area is damaged, not is equilibrium properly, not stand properly, not equilibrium your body properly. Okay, and now number 3, the patient whose this area is damaged cannot differentiate the different taste, like which is sweet taste, which is sour taste, which is bitter taste, which is umami taste, like different tastes cannot recognize properly and cannot take the memory, okay, and cannot like a installation of the memory in the part of your brain. Okay guys, so this is all about the fifth lobe of the brain, which is insular cortex. So guys, I hope you understand this. Please like, share and subscribe, and please press the bell icon to receive any new video. So guys, please made the notes and please watch also previous videos and this video. In next video I gonna explain to you the detail of the occipital lobe, okay, its pathways, its functional anatomy. In previous video I discussed, now I discuss the pathways and clinical relation about the occipital lobe. So guys, be happy, take care.